Following sustained advocacy about the gross inadequacy of this fund, it moved to 10 million. Again, very, very inadequate in 2024. And now, to 13 million in this year's budget. This year-on-year patry increase are no doubt steps in the right direction, but a far cry from about 300 million naira needed for operationalization of tobacco control fund. The Nigerian failure to close this funding gap has made legislative and enforcement efforts ineffective, with their consequences on public health. Tobacco is the leading preventable cause of deaths and diseases. It's killed half of its users. In fact, according to the federal government records, no fewer than 26,800 persons die each year from tobacco use. Tobacco-related illnesses lead to catastrophic health expenditures, particularly for the poor, trapping families in a cycle of poverty.
We are calling on the federal government to significantly increase the tobacco control fund beyond the present 13 million naira allocated in the 2025 budget in the interest of public health. We reiterate our call for an upward review of the allocation for tobacco control to a minimum of 300 million in line with the provisions of the National Tobacco Control Act. While we commend the government for increasing the allocation to the TCF, 10 million naira in 2024 to 13 million naira in 2025 is still a very small and insignificant amount, but we appreciate what they're doing, but it is still grossly insufficient compared to the level of funding required for the effective implementation of the National Tobacco Control Act.
The essence of calling for sustainable tobacco control funding is to ensure that when the donors pull out of Nigeria's tobacco control space, that the Nigerian government is able to continue to do what it needs to do. And every day that the government fails to allocate sufficient amounts of money to tobacco control, the alternative is that we lose lives. So my message to the government is very simple. You can save money or you can save lives. You can't do the two. So if you want to save money and say because of whatever budgetary economic reasons, whatever excuses that we have heard, and then you are not putting money into tobacco control fund, yes, you may be saving money, but you are losing the lives of citizens. People are dying every day as a result of tobacco-induced illnesses.